So we have a number of colleagues on the call today who I will introduce you to in a moment. Just before we start, I'm first of all going to apologise. I am working from home today and my next door neighbour has just decided to chop down a tree. So there's a bit of noise from my end, so I'll apologise for that now. But before we start as well, I would really encourage everybody, please do use the chat function in Zoom for posting your questions. We're going to have a really short presentation, first of all, from some of the local colleagues. And then we will then be going through the chat to answer the questions that are important to you. So please do start putting those questions into the chat. Feel free to ask absolutely anything that is on your mind. The webinar is being recorded and we are hoping to put that then onto social media later on in the day for others. And just wanted to remind people to, everybody has their own questions, so please do be respectful of everybody's opinions and questions. Please don't put any external web links into the chat, because that can sometimes cause problems. And so without further ado, I'd like to introduce you to our panel here today. Belinda, would you like to introduce yourself, please?
Hello, good afternoon, everybody. Thank you for that, Juju. So my name is Belinda. I'll give you two titles. So the fancy one is the Neurodevelopmental Community Paediatric Service Lead. It's a bit of a mouthful, but I am a registered nurse, I should say, and I look after a group of services in Enfield community, including the paediatricians and also immunisations, which is what we're here for today.
And Nitika, please introduce yourself.
Hi everyone, I'm Dr. Nitika Silhai. I'm a local GP from North East Enfield, and I'm also part of a PCN delivering COVID vaccinations to adults as well.
Thank you, Belinda and Nitika, great to see you. We've also got a few other members of our team working behind the scenes on the technical part of the webinar. So I'd just like to say thank you to Serena, Sveta and Marek for your help today, very much appreciated. Okay, so Belinda, I'm just going to hand over to you now to take us through how the vaccination programme for 12 to 15-year-olds works in Enfield.
Wonderful, thank you. Thank you for that, Marek. Okay, so my section is going to be as short as possible because we want to give as much time as we can for you to be able to ask your questions. So the 12 to 15-year-old vaccination programme for the children who are extremely clinically vulnerable, they've already started receiving their vaccinations. What we're talking about today is the healthy 12 to 15-year-olds who started their vaccinations last week. So we've already started. We started in Lower Edmonton in Enfield. We're doing about 2 schools a day. So to date, I think we've done about 8 schools and we're ongoing. So who is going to be immunising your children? So the service is provided by the school age immunisation service based in Enfield. Though I'm the one sitting here today, it's made up of a huge team of more than 17 staff. A lot of them are registered nurses, and they're the same teams who have been vaccinating your children against HPV, flu, and the whole national programme for many, many years in Enfield. So they won't be strangers to your children or to the schools. So the information that families will receive, the reason why I want to talk about this, because we don't usually do that when you're having your flu and everything else. It is routine, you get it, you consent, the children get vaccinated for COVID is obviously been quite heightened. It's a novel vaccine and it's the first time that your children will be receiving this. So, Marek, do you have the letter on hand or shall I? Perfect, thank you. So if you can see on the screen, this is the letter that you should be expecting from us. It will be sent via your school. They've already been sent. So some of you might have received it already and some will be receiving it in the coming days. Somewhere in the letter at the bottom, it gives you a link. So the letter is from Barnet, Enfield and Haringey, Enfield Immunisation Service. There is a link. There is a telephone number and an email of how to contact the team. The link takes you to our consenting site. Marek, you can go back to the slides. Thank you for showing that. And I should say that the reason why we're showing you this letter is because we have had some false information being sent to parents and schools, which are not from us. So if you receive anything that doesn't look anything like that, or you're remotely suspicious about, please give us a call or give your school a call and alert us to that. So back to the letter. So you get a link on there and you go onto the link. You can do, it doesn't have to be during the school day, it can be at the weekend, it can be in the evening, and you go on to answer a few questions about your child. We're asking about some medical history. Has the child had COVID in the past 30 days? A few other questions, and then you consent or you don't. So you've got all the information there. And I'm not here to actually convince you and say you must do this. I'm here to give you all the information so you'll be able to make that decision for your child. Once you've consented, this is what will happen on the day. So on the day of the vaccination, my team will arrive at the school. The children will be brought down, whether to the school hall or to the canteen, depending on the school and the facilities, whatever's available. But we have actually been vaccinating in those spaces for many, many years. We will check the identity of the children. We'll go over the consent again to make sure that the child wants to go ahead with the vaccine. And sometimes on the day, children have consented, but they may be absent from school, or you've consented, you've had a chat with your child, and on the day, for whatever reason, your child or young person decides, actually, I don't want to do this today, or that they're needle phobic. We've been managing this for many, many years, and we know exactly what to do in those situations. I know a lot of parents have this question because the children are not little people, they're 12 to 15-year-olds who have their own ideas. Believe me, I know that. I've got one at home. They've got their own opinions and their own ideas. If the child decides to consent on the day without prior discussion with the parent, we're not going to do that. So we're not doing any opportunistic vaccinations on the day. We will come away and we'll have a clinical conversation with the parent or the carer to make sure that is what you both want, and then we'll go ahead and rebook that child. So I know some parents have been concerned because we're going in on the same dates that we're giving flu, that if they consent to flu, are we going to give the COVID vaccine? And the answer is absolutely not. You're consenting for that medical intervention, so it's either flu or it's COVID, or you're not at all. Or you've consented and you've changed your mind on the day. You can withdraw it up until we actually give that vaccine to that young person. We are working very closely with the head teachers. We know our schools. Many of my staff have been working in Enfield since for the past 20 years, I should say. They won't thank me for mentioning that, but we know the schools and we know the children. So we're working very closely with them and with yourselves as well. Marek, could we have the next slide, please? Thank you. So as I said, we're working very closely with you. If you have any questions about the consent, about the day, if your child is needle phobic, if there are any medical conditions that you want to tell us about, you can always contact the immunisation service. We have somebody every day and the nurses are on hand to answer those questions. Thank you very much.
Thanks, Belinda. That was great. Fantastic to see we've got a few questions coming through in the chat. So we just wanted to encourage everybody to continue putting those questions in. This is your chance to, ask us the questions that have been on your mind. So our first one is, are we planning to give nasal flu vaccination on the same day as the COVID jab? Belinda, you've just been talking about that. I wonder if you could say a little bit more, and whether any other vaccinations are being offered as well.
Okay, so we can co-administrate, meaning we can give out the same vaccine. I should mention it's Pfizer that we're using for this age group, and we can do flu, which is why we booked a lot of our COVID vaccination dates on the same days that we're doing the flu vaccines, purely because we don't want to keep taking children in and out of their classes. So if we're there and they've consented to both, we can give both of them.
And our participant was concerned that the government guidance is to have a week in between. Can you mention that we are also following guidance on that? Nitika, you might want to come in on that one as well.
Yeah, sure. Thanks, Dudu. I'm not aware of the Bristol Uni study that you've mentioned there, but the St George's study came out earlier this year that showed it was safe to co-administer. The European and the American medical associations have both said it is safe to co-administer both flu and COVID vaccinations at the same time. And it is currently what we are doing in our adult populations, because, as Belinda has said, it is more convenient, it is more practical, but certainly if you were to request that you want both vaccines but you want them on different days, then that's a conversation you could have with the vaccination team, because I would assume that the vaccination team are going to have to go back into mop up missing people, and it may be possible for your child to have 2 vaccines on 2 separate days if that's something that you're worried about.
Thanks for that, Nitika. Belinda, just whilst we're on the topic of mop-up sessions, could you mention the provision for students who, for whatever reason, are not available for vaccination on the day that you happen to visit the school?
Yes, thank you, Dudu. So I mentioned earlier that we've been vaccinating, children for many, many years, and we know from experience, especially from the flu vaccines, that there are times that we go in and children are just not there, they're sick, they're unwell. So we've always had community mock-up clinics for those children, and we're following the exact same template for children with who are absent for COVID vaccination. So during the school half term, and I think it's from the 24th of October, the half term starts, for that whole week, we've got community clinics that have been set up from Monday to Friday. We're doing some at the weekend as well. So if your child is unable to have it for whatever reason, or we've been to the school and you decide that actually, I know we've been to Edmonton last week, and I want to have it now, we can always book your child into those half-term clinics. So we will be doing mopping up until the 1st of November.
Thanks, Belinda and Nitika. So we've got another question here about allergies, and I know that you can't give people specific medical advice at the moment. Our recommendation is, if you do have very specific medical conditions, that you actually speak to your own GP if you do have questions. But in general, if people do have allergies such as nut allergy, sesame or grass allergies, or other conditions such as ADHD, is it okay for them to go ahead and have their COVID vaccination? Nitika, if you could answer that one, please.
Thanks, Dudu. So having now delivered adult vaccinations now for well over sort of 9, maybe 10 months, what we are seeing, is particularly with the Pfizer vaccine, is that unless you are allergic to the actual ingredients, and which are listed in the Pfizer vaccine, then it is usually safe. Even if you have allergies to things like nuts, grass, things like that, it is safe to have the Pfizer vaccine. I would probably repeat what Dudu has just said, though. If you have concerns, if you are worried about particular allergies, it may be an idea just to speak to your GP, submit an online consultation, just to get confirmation of that. The ADHD, Tourette's, autism, these aren't affected by the vaccination, and I'm sure Belinda's team have got processes in place for special administration of vaccines to that group of children.
Thank you, Nikita. And I was going to say, just to add on as well, that we do ask these questions on the consent form, and on the day, we do ask the children for any relevant medical history. So if there's anything that they divulge to us, or you as well, as a parent, while you're consenting, we will have a separate conversation with you if we need to.
Thanks both. So we've got another question. Is there any evidence that the vaccine will protect us, or will protect the 12 to 15-year-olds against any new variant of the virus? I think that's a difficult question to answer because we just don't know the future. But it depends on the level of mutation between our current variant, which you'll have heard from the news. A variant called the Delta variant is dominant in the UK at the moment, but it does depend on how the variants evolve over time as to whether our current vaccinations will be effective against them. Belinda, Nitika, I don't know whether there's anything that you want to add to that question.
Yeah, I mean, you've said it, Dudu, and just to remind everybody that new variants are not new to viruses, which is why we have a new flu vaccine every year, and the variants are monitored very, very closely by the necessary agencies in the UK. Yeah, I don't think there's anything else to add to that. It's very difficult to predict the future, but what we do know is that this vaccination will protect against very serious illness and death. Doesn't completely stop you from passing it around, but if most of you, if you look at your children's schools and the number of days that have been lost, not just through lockdown, but after they've gone back, with children who have infections, and some whole classes have been sent home. Though it's not directly because your child is ill, they're still interrupted in their education and their development, and we already have about 18 months of education to catch up on.
Thank you. It is an excellent point, Belinda, and I know that speaking to education colleagues, we are all very concerned about the level of education and social interaction opportunities and other opportunities that are available at school that that children have missed out on. So I just wanted to encourage.
We probably should. Yeah. We should probably just mention as well, we have been lucky so far in that there have been 3, maybe 4 mutations of this virus, and this vaccine does cover them so far. So there's nothing to say that our luck won't continue in the future, and the vaccine may continue to protect. The research that has been done, the way the vaccine was actually created, it seems to have picked up on that major spike protein, and up to date, that major spike protein has been visible in all variants of the virus. So the vaccine has been able to protect us against all variants. So long as the virus doesn't mutate that major spike protein, I think it's safe to say that the vaccine will protect in the future. But as you've said, we can't guarantee that.
Thank you both. So I just wanted to encourage everybody to continue putting your questions into the chat. I think we've answered all of those that have come through at the moment, so please send us some more through. Great, thank you. That was quick typing. So we've got another question. This person has got daughters and they are concerned about potential impact on fertility. Belinda, do you want to take that one?
I'll let Nikita take it first because they've been doing the adults.
Okay, great.
Thank you, Belinda and Dudu. So far, we've not seen any adverse effects on fertility. The Americans actually have produced research showing that pregnant women have safely delivered normal children having had the vaccine. We are now encouraging our pregnant females to have the vaccination during their pregnancy. We're not seeing any effect on fertility, both male or female. The vaccine doesn't modify your genetics. It doesn't, it's there in your immune system to protect you. It doesn't target your ovaries, your womb. That's not its role, and that's not what it was designed to do. So far in the medical world, we have no concerns regarding fertility. And in fact, the regulatory bodies, the Royal College of Obstetricians, Gynecologists, the Royal College of Paediatrics have all come out and said that, they have no concerns about this vaccine on fertility.
Thank you. Belinda, do you want to add to that? Okay.
And Nikita, she's covered it, yeah.
Yes, great, thank you. So we've got another question. Do we have data available to show how many children have had adverse side effects to the vaccine? And I'm just wondering whether it's worth starting off just by talking about what some of the more common side effects are, such as the sore arm or, a bit of an ache in your arm for a couple of days. Belinda, do you want to take us through side effects?
So the side effects, let's just mention that though in the UK we're starting this age group from last week, they've actually been immunising in Israel, in Europe, in America. So we're in the thousands in England, but we're in the millions worldwide. So far, there hasn't been any major side effects reported. I'll let Nitika talk about the cardio for the very, very rare few, but local side effects is obviously after vaccination is the sore arm. Sometimes there will be temperature. We have a very robust way to record any side effects for all immunisations, not just for COVID. We have the yellow card system. We've got, processes in place. So when the teams go in, and parents are very good at reporting to us that if there are any side effects, then we report that in the UK, and that's reported back nationally. So you can get information on that. Nitika, was there anything?
No, I think you're completely correct there, Belinda, in that, the list of side effects are the usual side effects you would get after any vaccination. So, it hurts in my arm, a little bit of a fever, headache, sort of muscle ache, joint pains, things like that is quite common. And, your child may have that after their HPV, after their tetanus immunisation. Those are quite common side effects of just a vaccination, not particularly of the COVID vaccination. I think what has probably confused the issue is that the research studies don't differentiate between, what as a parent you would say is a huge adverse side effect, ranging up to sort of death, against what we would class as a minor side effect, which is, oh, my arm aches for the next 24 hours. And some of the research papers, and I've certainly seen on social media that, you know, people are bandying about, oh, 86% of children have had an adverse side effect to the COVID vaccination. I think if you ask most adults who've had either AstraZeneca or Pfizer vaccinations and have had both immunisations, that they probably did have a side effect to one of those two vaccinations, but it was so mild. And was it actually a side effect of actually just having a vaccination rather than just having a COVID vaccination? Going on to what Belinda has said about the most serious side effect, which was of inflammation of the lining around the heart. This was found to be in a very low percentage, but after the second vaccination, which is why currently those children aged between 12 and 17, in fact, are only being given one vaccination, not two, until we have more information. The studies are still coming out. I saw one about 2 weeks ago that actually said it was more likely to be in boys rather than in girls. It was more likely to be in the slightly older, sort of 16, 17-year-old group. So we are still working on that as a research question. And that's the reason why at the moment your child will only get one, because it's been deemed safe to give your child one.
Thank you. Nitika, I understand though that young people in the 12 to 15 age category who do have underlying health conditions are being offered two vaccinations. That's correct, and that's just because they are slightly more at risk of implications from COVID infection than the 12 to 15-year-olds who have no underlying health conditions.
Absolutely, and everything we do in the NHS, we look at the risk versus benefit, and we look at, you know, what is the harm that will come to the person if we do something to them. And we've looked at that age group of clinically extremely vulnerable children aged between 12 and 15, and actually the risk of them contracting COVID, the risk that, you know, the COVID will give them long-term symptoms, that it will harm the original condition that makes them extremely vulnerable, has outweighed the risk of having the second vaccination. And as I said, the numbers of, you know, that potential inflammation of the heart lining are very, very small, but it was felt the risk in those children that are, you know, essentially healthy was not actually a sensible risk to take at this present moment in time.
Thank you. So we've had another question coming through. Have we found that women's periods have become heavier since having COVID vaccination? And could that affect girls having vaccination? Nitika, if you could take that one.
Anecdotally, yes. I've dealt with several females who found that their periods have gone a little haywire after either the first or the second vaccination. But in the majority of my patients that I've dealt with, a few months later, it has all settled down and it's all back to normal. We don't know whether that's due to the stress of having the vaccination, whether that's just, you know, over the last 18 months, we've all been under extreme amount of pressure. Having the vaccine for some of my patients has been an absolute boon. They've been so relieved. It's enabled them to, you know, go back to a semblance of their normal life, and has some of that relief also then affected periods. You know, the female ovulation cycle is so susceptible to so many things that actually we can't say that, yes, it is purely down to the vaccine. It could be down to other sort of stresses in their life as well. But anecdotally, yes, we have seen that.
I've also heard about this anecdotally, but I'm not aware that there's been any sort of specific research reporting on this as yet, and certainly in the discussion papers that I've read, there was also discussion that the groups where vaccine uptake has been highest is obviously amongst sort of slightly older adult women, certainly over 40, where you know, their periods may be starting to be slightly irregular anyway. So it could be that it's just a coincidental occurrence as well. So there hasn't been any particular evidence around that reported as yet. So we've had a question about consent. Could we please explain the consent process? If a parent does not give consent, can a 12-year-old legally consent for the vaccine themselves if they decide to? Belinda, if you could take that one, please.
Thank you very much, Dee Dee. I know this is a contentious one. So those of us who've been delivering vaccinations for years, we've never ever been confused about the consent process. And I'm really glad that you've asked that question, because of what we've heard in the media, on social media, on WhatsApp groups, what's been out there. It's kind of been almost, people are being, I don't want to say wound up, but it almost feels like that. But on the ground, we don't have any such confusion about that. So the legal precedence for consenting for this age group for vaccination has been set since 1985. There's been no new legal precedence set, nothing came out specifically for COVID. So we are using what's already laid down, which is that a child of that age can consent for themselves. On this occasion, for this COVID vaccine, we're not doing, I'd mentioned earlier on, we're not doing any opportunistic consenting on the day as we do with other vaccines, because it is a very, it's very new to families. Those of you who've been vaccinating your children against flu for years and years and years almost don't even think about it. When that consent form comes, you know, you tick and we get on with it. This is the first time we're delivering this to your children. And so we understand why there are questions about it. If on the day practically you have not consented and a child comes up to the nursing group and says, I've thought about it, I've done my research, and my parent doesn't agree with me, but actually I'd like to have the vaccine, we're not going to give the vaccination on that day to that child. What we will do is rebook that child with the parent. We're going to have a clinical conversation where we come to a workable solution. To date, I mean, you know, we've been doing it for a few years and we've not come across with the child. But if we do, we have a set process in place and we will follow that. What I can assure you today is that we are not going to vaccinate any child with COVID in that age group without speaking to you first if you have not given us prior consent.
Thank you, Belinda. I hope that that clears up that question. So we've got another great question, and certainly in our previous webinar there was lots of questions around if a child has already had COVID infection, should they get a vaccine, and when after their COVID infection should they get that? Belinda, do you want to take that one again?
So that's one of the questions that we do ask, is that has your child had a positive test in the past 30 days? And generally, if the answer is yes, we'd like to wait 28 days before we give the vaccination. So we will rebook them, but we will definitely ask the question. Nitika?
No, spot on. We do the same in the adult services as well. We do not give the vaccine within 28 days of a positive COVID test. Just, you know, we're allowing your human immune system just to build itself back up so that it can then take on the vaccine and learn from the vaccine and, you know, provide an adequate response.
Thanks both. And just to confirm, we would absolutely still recommend that, providing that your child didn't have their COVID infection sort of within a month of when the vaccine is being proposed, we would absolutely encourage you to consent for your child to have vaccination, because it does provide extra boost to the immunity that they will already have had from their COVID infection. It certainly won't, you might have concerns about, how it would impact on the immune system or something like that. There's certainly no concerns around that.
Just to add to that, just to add to that as well, we are seeing reports now that sort of the natural immunity after the infection does wane, it does decrease, and so the immunity after the vaccine tends to be longer lasting and of a stronger response. So yes, obviously, if you've had COVID, you do have a certain amount of immunity. I think your question is, does the vaccine offer more protection? I don't think anybody's actually ever looked at a direct kind of trial of vaccine versus natural immunity, but we do have reports now that the natural immunity will wane and disappear, in which case you will need the vaccine at that point.
Thank you. So I think we've answered all of the questions in the chat. So please do post any further questions if you have them. In the meantime, in our last webinar, we had some questions about what happens if your child is not yet 12, but they are reaching that 12-year-old, their birthday soon. Belinda, do you want to take that question?
Yes, thank you. Yeah, that's a good question. We've had a few phone calls actually where the letters have gone out to the schools, to parents, and they're ringing up saying, I know you're coming to the school on Monday, my child is 11, but on the Tuesday they will be 12. So that's yeah, that has happened. So we will not vaccinate on the day that we come to do the vaccination. If your child is not 12 on that day, the vaccination will not go ahead. We are still waiting for direction from National as to what's going to happen after the 1st of November. If your child turns 12 during half-term week that we're doing the catch-ups, we will book them and we will get that done. But we'll have more direction after the 1st of November as to what we do if your child turns 12 after the 1st of November, and I'm sure there'll be many, because obviously the school years, in the way that we vaccinate for flu and other vaccinations, we go by the school year, which could have 11 or 12-year-olds or 13 and 14-year-olds in that same year, depending on which time of the year they were born. So this is slightly different. We're going by date of birth. So if they're not 12, we won't vaccinate, but we will come back if they turn 12.
Thanks, Belinda. And what happens if the child is over 15? Sorry, if it has reached their 16th birthday already, can they be vaccinated in school, or will they need to go to one of our other sites to be vaccinated?
So Nitika's not going to like me, but that will be for the GPs to do, and some of the large vaccination centres that have been set up as well. I believe there's about 4 in Enfield will be able to do this age group. So I know what that question is about, the sixth form cohort who is 16 to 17. For us, our remit is the 12 to 15-year-olds. And anything over that will be back to the GPs and the vaccination centres.
Great. So just to make people aware, we've got 4 primary care sites in Enfield, and currently we've got 4 pharmacies as well, and we've got an additional 4 pharmacies that are going to be offering vaccination from the 4th of October, I believe. All of the information about sites for vaccination are available online on our council website and also on the NHS website. If you Google that, it should come up. So there's lots of opportunities across the borough for your 16-year-olds and yourselves, if you haven't yet had your vaccine, to be vaccinated. Nitika, I can see that you wanted to come in there.
No, just to say that several of our Enfield sites, and we have been blessed in Enfield, are walk-in for 16 years and above, and the 16 and 17-year-olds can consent themselves. They do not need parental consent, so if that makes it easier for you to send your, and I can appreciate, you know, some of our fifth formers are going to be 16 and will not be included in the school cohort. But yes, we have a plethora of sites in Enfield. The majority of them are walk-in, and the child can walk in and get vaccinated themselves. Again, though, as a 16-year-old or a 17-year-old, they will only receive the one vaccine.
Great, thank you for that. And definitely having a walk-in does make it very easy, so there's no need to book on the national booking site or anything like that. You can just turn up, and there are also sites that are available sort of you know, into the evening as well, so lots of availability, which is fantastic for us all. Belinda, Nitika, is there anything that you think would be useful for parents to hear about that we haven't already spoken of? Sorry to jump that on to you. We've gone through all of the questions in the chat, but if you can think of anything that, you know.
I mean, it wasn't anything, you know, directly for individual parents, just, you know, to let Enfield parents know that a lot of the people who are doing the vaccinations, you know, they've been doing it for a long time. They're very experienced. Your child will be looked after. Directly after the vaccination, there's a 15-minute observation period anyway. And then obviously the schools know that this cohort have had the vaccination and will look out for anything during the school day. And then they will hand over to you in the evenings to look out for anything, and obviously report back and let us know if there's anything that, you know, is different for your child on that day. Should also mention that all of those people who are doing this, a lot of them have got children in this cohort as well, and they also have to make that difficult, you know, decision that you're having to make. You know, a lot of people are in that position, so we completely understand. There are no stupid questions. You know, ring us up. I won't say ring your GP because Nitika might get me afterwards, but yeah, just, you know, give us a call, and the nurses are there and they're happy to discuss and go through any question, you know, that you have.
Thank you. So we've had another question through in the chat, so thank you for that, DT. What are the implications of attending school if a child doesn't get their COVID vaccination? I mean, for me, I think that obviously if a child is vaccinated, they are much less likely to contract COVID infection, and they are then much less likely to have any illness from COVID infection, and less likely as well. There are a small number of children within this age group who have gone on to develop what we call long COVID, which is a kind of ongoing variety of symptoms following an initial COVID infection. So I think that those are really the main implications. Schools are not going to, you know, make any alternative arrangements for children who have or have not been vaccinated. They're not going to be treated in any different way. But I think that the implications really are that your child is much less likely to suffer the impact of COVID. Nisika, I don't know whether there's anything that you want to add to that.
I certainly, I empathise with the question. I'll give you a personal anecdote. I have a 13-year-old and a 16-year-old. My 16-year-old has been vaccinated. I'm, quite open about that. My 13-year-old hasn't as yet, just because the school team haven't got there. It does make a difference, that both my teenagers have missed out on so much of their school life over the last 18 months, the social aspect, the emotional aspect. I see so much difference in just the first month of school, of the fact that, my daughter in the sixth form is able to sort of go in. Yes, there have been positive cases, but school has continued to run. School, the mixing has continued to happen. It lower down in the school, unfortunately, where they get more than 10% of the year contracting cases, we're back to homeschooling. And just, go and get a PCR test and the kerfuffle and as a working mother myself as well, it does impact on the rest of the family. So I appreciate, this might be more about kind of, will the school, differentiate, but actually I think we have to look at the wider picture here of vaccinating our children, not just for the health benefits, but for, their emotional, mental and social benefits as well.
Yeah, absolutely. And, it's definitely a good thing if those, potential days lost to education are not lost as well as a result of being vaccinated. I know that Belinda also has a child in this age group, as do I. So we all empathise with your decision, and we did discuss it on our last webinar. I'll also be getting consenting for my son, who's 14, to be vaccinated. Belinda?
I will also be consenting, and it wasn't, lots of research, just as all of you have done, lots of reading around, and I've come to the conclusion that looking at, I've said to you yesterday, that the whole of his class is at home at the moment because of the high infection rate, and over the past 2-3 weeks, the highest infection in England has been in children. So yes, he will be vaccinated.
Great, thank you. So we've got another couple of questions. Who do parents contact if in the unlikely situation that their child does have a reaction to the vaccination? Will parents be receiving information about that as part of the information that you provide with the vaccination? Belinda? Yes,
absolutely. So on the letter that Marek kindly showed us earlier on, there's a few links on there to the NHS England website. There's also a link to the yellow card reporting system. So anybody, doesn't have to be a doctor or a nurse, anybody can report a side effect from a link. Have I frozen?
We can hear you, Belinda.
Okay, so anybody can report it. You can ring the immunisation service. We're happy to do it for you, or you can just go on the Public Health England or NHSE website and report that. There is an information pack that we've provided and is in that letter as well. And one of them is specifically geared towards the young person. So it's in very simple language, very basic, and it's all the what happens if and what do I do if. And so we'll provide all that for you on the day, or you can find the links on the letter.
Great, thank you. And another question is, will children be required to isolate after having the vaccine if they've had, I think what the person means, if they've had contact with a child, with another child who has COVID, yes, had contact with another child who's had COVID. So I can answer that. So at the moment, if a child is a close contact of somebody who has got COVID infection, irrespective of whether they are vaccinated or unvaccinated, they will need to have a PCR test. And so this is, it's not legally required, but it's advised as part of the government advice for controlling the transmission of COVID. So the child will need to have a PCR test, and providing that the test is negative, they will not need to self-isolate. But obviously, if a child is vaccinated, they are much less likely to pick up COVID infection. So by vaccinating our children, we will be protecting them against COVID infection and all of the health, education and social implications that has, as we've talked about today. So I know that we've got about 4 minutes left before we close. I don't know whether anybody's who's joined the call is sitting on a burning question. If you are, now's the time to ask it. Pop it into the chat. In the meantime, I would really like to thank our technical team, Sveta and Marek and Serena, who've helped us to put on this webinar today. And of course, lots of thanks to Belinda and Nitika for all of the answers and reassurance that you've given to parents today. So I can't see any burning questions coming through. So as well, lots of thanks to parents who have joined us today for this hour. We hope that it's provided you with information from trusted sources that will inform your decision. Please do remember you can contact Belinda's immunisation service. The link to that and the telephone number has just come into the chat, so thank you, Marek. If you do have any other questions, please do contact Belinda and the team. So once again, thank you everybody, and I hope you have a fantastic rest of the day. Bye-bye.